we're all pretty tired of Zoom seminars, but we really thought that if we could design something that was offered by members of our community for members of our community, then we'd really have an opportunity to re-engage and maybe re-inspire everyone around the world to keep joining us at Edge. And so I'm really excited to launch this first one, where we should be having monthly ones for the next few months. And Megan will have those dates soon, and we'll follow up with you shortly after the seminar. But today's our first one, and this is led by members of the Johns Hopkins Edge Student Society, which launched last year, and then this is the first full year running. And so I'm going to turn it over to the leadership of the Edge Student Society, Sofer and Rakshanda, and yeah, please get us started. And thank you so much for organizing this, and thank you all for joining us today.
Thank you so much. Am I audible? Yeah, okay. I think you can hear me. Great. Yeah, so thank you. And thank you, Edge Network, and thank you, our panelists, for making the time today to join us on this webinar. And thank you, our participants, for making the time to be here as well. So today we will be doing a webinar that will help us in navigating career alignment as an emerging women leader in global health. And as mentioned, it will be presented by the Johns Hopkins Edge Student Society. So what is Edge Network? Just to say a little bit, it's a vibrant professional network and community fostering, community fostered through various networking opportunities like Slack, our various events, and our mentorship that you'll see all throughout. And just to say how much we value mentorship at Edge Network, all of the three panelists are women I consider mentors. So this has been a wonderful opportunity to moderate this webinar, and it's a hub for building essential leadership skills and for emerging women leaders as well. And we support women and male allies in academic and non-academic arenas as well. So who we are is we're the student chapter for Emerging Women Leaders in Global Health Network at the Johns Hopkins Center for Global Health. We're a dynamic Hopkins-based student society, and I've already mentioned our vision and mission, which has the primary objective of empowering women, male leaders, and non-binary individuals to practice in this and a gender transformative leadership, and to support budding women leaders and ensure that this is a cultivating space for them to develop their leadership skills as well. So without further ado, I'll introduce our panelists. Sorry, I don't know if you're seeing the presenter view or not.
We're not seeing the presenter view.
Okay. So it's the full screen that you're seeing, Megan?
We're seeing like your full screen.
Oh, I don't know why.
Now it's fine.
It's fine now? Okay. So our first panelist is Ribgat Nafu-Boyer, and she is an MPH holder and currently serves as the research associate at the Johns Hopkins Bloomberg School of Public Health, and currently conducting a research on cancer prevention and screening. And she currently leads a study identifying barriers and promoters to colorectal cancer, screening for Black immigrants and refugees in the metropolitan Baltimore area and Prince George County. It's a qualitative study with funding from the Cigarette Restitution Fund, or CRF, at Johns Hopkins. And from 2016 to 2024, Ribqa proudly served as the director of the Bunton Neighborhood Leadership Program, or BNLP, as an intensive leadership fellowship and mentoring program for emerging community leaders in Baltimore City. Ribqa applies her passion for mentoring by guiding BNLP graduates in professional and personal development and serving as a faculty advisor to African Business Club at Johns Hopkins Carey School of Public Health. She established R&D Associates, which is a capacity building organization in Baltimore, and Zeni's Gift, which is named after her mother, to provide academic and professional development guidance to students and professionals primarily from Ethiopia, her hometown, and other African countries and Africans. In addition to her extensive experience in research, leadership development, and mentoring, Ribqa has extensive experience in community engagement, youth development, sexual health, community assessment, program evaluation, strategic planning, community coalitions, and program management. And she serves on many boards. She has a bachelor's degree in biology from Binghamton University and a master's in public health from Columbia University. And just to say a little bit about her family, she's a proud mother of two men, Mikias and Minilik, and has acquired two daughters through marriage to David Boyer to form a beautiful and blended family. So a very well-rounded bio on her, but I'm sure we can say more. But for the essence of time, I will go on to our second panelist, Dr. Maraki Merid. She's a PhD and MPH holder. She is a native from Ethiopia as well, and she has a deep passion for the betterment of healthcare in Africa, focused on developing innovative service and financing models that encourage both private sector partnership and increase affordable quality access to care while supporting sustainable and systemic resilience. She's a founding partner of a boutique healthcare advisory firm called THS Advisory, with offices both in the UAE and Ethiopia. And she brings more than 20 years of healthcare and education experience, mostly focused in Africa and other emerging countries. She specializes in strategic consulting as well as operational management services, with assignments and market experience across more than 10 countries in Africa, and donor, public, nonprofit, and private clients alike. So very broad. And based out of Addis, she's been based out of Addis, Ethiopia since 2016, and recently established in Toronto, Canada. And Maraki is considered a leader in private health sector engagement in health and public-private partnership consultancy, with focus on market shaping models and research, including designing and implementing market diagnostics and assignments. She has supported the design of catalytic framework for market assessment interventions with regional health agencies such as UNECA Pharma Initiative and pooled procurement, the Africa CDC Sustainable Financial Facility, Africa Resource Center, and UNAIDS, to name a few. Her passion for social impact and transforming healthcare systems recently drove her to establishing innovative models for supporting health education and health entrepreneurship. She has, in the last 2 years, co-founded Youth Education Services, which is a learning center in Addis, as well as a social enterprise in Canada that aims to empower high school youth, new graduates, as well as professionals in Ethiopia and in the diaspora across career paths, supporting with industry relevant experience and skill. And this complements her work with CHS in skills development pathways in healthcare and pharmaceutical industry. She is bilingual, speaking both French and English, and has a PhD from the University of Toronto at the Department of Health Policy Management and Evaluation, and she holds a Master's of Science in Epidemiology and Bachelor's of Science in Biochemistry from McGill University in Montreal. We have some powerful women, and I will go on to introduce our last panelist, Jeanette Jeffries, who is an MS, MPH, and MCHES holder, and currently serves as the Career and Life Design Coach in the Johns Hopkins Bloomberg School of Public Health. 3 years ago, Jeanette Jeffries returned to what she likes to refer to as her happy place, otherwise known as Johns Hopkins Bloomberg School of Public Health, to serve as the inaugural Alumni Career Fellow for the Office of Career Services on the request of the Executive Director, Paul Hutchinson. As an MPH graduate of 2008, Jeanette has firsthand knowledge of the rigors, anxiety, stress, growth, accomplishment, and ultimate joy of the 11 months program brings. With over 30 years of experience in higher education, Jeanette has taught and championed public health from community college to medical school. And her MPH capstone project helped usher in a new wave of public health students through the development of the nation's first Arts and Science Associates of Arts Transfer Degree program in public health, which she implemented, taught, and directed at Howard Community College. And to ensure seamless transfer of credits, Jeanette formed an articulation agreement between Howard Community College and the University of Maryland, Baltimore County, where she also served as an adjunct professor. And due to her academic contributions, Jeanette was asked by American Schools and Programs in Public Health to serve as an expert panel member in the development of recommendations for undergraduate public health curriculum. And she is greatly honored and humbled to serve our brilliant BSPH students who inspire hope and collectively contribute to our mission of protecting health, saving lives, millions at a time, as the Bloomberg motto goes. And without further ado, these three panelists will walk us through their career journeys. We will hear about the various aspects of their careers, how they chose their careers, what were the battles, how did they pick public health, and then we'll go on to discuss career alignment and job search strategies with them, and then we will hear from our participants. So I will be moderating the session. My name is Fikat Dadi. I'm a medical doctor by profession, and I'm currently doing my master's in public health at the Johns Hopkins Bloomberg School of Public Health. And currently I serve as the Vice President of the Emerging Women Leaders in Global Health Student Society. And my fellow member, Shruti Sakar, who is our social media head for the society, will be moderating the Q&A session later on. So without further ado, I would like to open up the floor to our panelists to just discuss their journeys. So Rivka, I will start with you, and then Dr. Marak, you can go ahead, and then Jeanette, you can share your journey with us.
Okay, thank you so much. It's a pleasure to be here with Edge. Thank you, everyone, for joining us from around the world. I see the various chat messages, people representing different parts of the continent. Thank you, and thank you, and welcome to my co-panelists, and especially Dr. Maraki, whom I've known for quite a few years, and I haven't chatted with her more recently. And thank you for Fikar, and I'm hoping that you have having a wonderful year as a new School of Public Health student at our fabulous Johns Hopkins School of Public Health. So my journey to School of Public Health, or my journey to public health field, started really in 4th grade when I was in Nazareth School back home in Ethiopia, and I picked up this red book with white lettering and said health, and I leafed through it, and then I was like, this sounds really interesting. It was very interesting and fascinating. I took it home and read it cover to cover, and I was like, I told my mom, I'm going to be a health professional. She said, yes, a doctor. I was like, no, Mom. I mean, everyone wants their daughter to be like a doctor or an engineer back home. I was like, no, not really a doctor, but I want to do public health. And so I started my journey with that book that greatly influenced me, and with a very, very strong foundation of the school that I belonged in, which was a Nazareth School, a private girls' school. So that really strong foundation, also being from Africa, where a large number of our people die from preventable diseases. My interest in public health was very well founded, and I wanted to make a difference in my country. So I journeyed to the U.S. To continue my education. I came here in high school because of revolution that was happening, communist revolution that was happening in Ethiopia. So I came here, went to school, studied. I wanted to have like a really strong scientific background. So I studied biology, and then continued my master's in public health. So I thought that was like an awesome combination, from just granular, from a cellular level to then the public health level. I enjoyed my journey. And when maybe I'm giving my age a bit, and which is kind of fine also. But when I applied to School of Public Health, there were only 14 schools of public health in the United States. You hear me? Only 14. Now there are over 100 schools of public health. So in a way, it indicated that the field, or the interest in public health as an academic field, has greatly grown, and as a professional field. And you know what? It grew even more during COVID's time, because people really did not have much of a sense of what public health, what the field of public health really is. And then COVID happened, and then they became really aware of the massive contribution that public health makes all the time, and the importance of that field. So it is an honor, and I would say, you know, shout out to my alma mater, Columbia School of Public Health. At that time, because public health was really kind of new, I didn't feel like I got as much in-depth training as you all are getting now at Johns Hopkins School of Public Health. So I'm a bit envious there. So I have always been on the cutting edge also in the work in public health. By that, I mean, the year I graduated in 1985, the epidemic, the HIV epidemic was happening. And I graduated, of course, from New York. I mean, Columbia's in New York City, and New York and San Francisco were like the centers for the HIV epidemic. So my first job was actually as a counselor for New York City Health Department that in that field in HIV. And also that same year in 1985, our Surgeon General Everett Koop announced that violence was a public health problem. So as you can see, my decision to pursue public health was really, really on point, not only in terms of service to Africa, but also service right here in the United States. So I don't want to take too much time, so I will stop there, and then I will continue on later on. Unless there's more time now. Yeah, so you let me know. Okay.
I think maybe you can add on as we go on to segment 2. I'm pretty sure you have a lot in your journey that we would like to know about. That was so interesting. Weirdly enough, Nazareth School is also how I ended up in going into the health field, but mine was different. It was when we were looking at the sheep's heart or something, I don't know. But yeah, that was an inspirational place to start out. Thank you for sharing that. I think we will go on to our next panelist, Dr. Maraki, and hear from her on her journey.
Thank you so much. Again, like it's quite difficult to come after this, but it's such a pleasure to be on this panel. Fikr, all of you to share my experience. I think mine slightly a bit different. I come from a middle-income family, very politically involved in Ethiopia, whereby I was in the French school, a private school, where the exposure was a bit different in terms of the French school was very influenced by the French exposure into global health, but other matters politically as well. My life was shaped, I think, from my personal life and my career choice. I've always wanted to be a lawyer, actually, so from the beginning, but I unfortunately lost my father to political insights, and I was raised by a very strong mother who really raised us and took me from high school from Ethiopia, finished in Kenya high school, and sort of came to Canada. So the French school gives you a very good scientific background. And so from law, I said, no, it's justice that I want. It's more of an ethics. I wanted to solve the injustices I could see in the society. And so I went into, first because I was so good in biochemistry. So my degree in McGill was first biochemistry, which I still really loved the research aspect. I was creative and so forth. And then eventually said, okay, no, I can't stay in a lab for all my life. I need some kind of a general impact. And as Rivka said, that's when the field of public health actually started booming. University of Toronto Norm McGill didn't have an actual public health school at that point. But as I went into it is when they shaped up. So when I went into public health, I chose the statistical, epidemiology at that point, which was the emerging field of choice. I didn't know I was landing into an emerging field. I was good statistically. I chose that because, interestingly, from a woman and I've always said we had no choice. I had to either get a job quickly in Canada. I was an international student. So my jump to career was almost like an urgency. I had to do something about it and figure out what I'm good at. I really leveraged on networking. Mentorship also then was not, especially in Canada, was not so prevalent. So I didn't have necessarily a mentor. My mentors were more my global, my mother's friends, my other leaders and so forth. But I went into career simply purely, and I volunteered to the Montreal Neurological Institute in McGill. So I leveraged on volunteering, internships, and my social networks. So I had to actually I remember I said, how come, and if everybody can communicate much better than me? I was very soft-spoken and not very, so I said, I'll take courses. I got very good at presenting. I went to network sessions. And that's why I linked from my volunteer work immediately. The School of Public Health and Epidemiology took me in as a researcher. Then eventually, to my first career jump was into the Canadian Institute for Health Information, simply from my hard work, my social interactions, and my networks. So I made them believe you cannot do it without me. So that's really how I shaped my journey from education to career. It's not as simple now, I understand, because of shortages of jobs and really not easy to link. But afterwards, another pivotal moment was from Canada. I always wanted to go back to Africa, was a move of my husband then, which I married, and we went to Middle East. So when I went to Middle East, the woman factor, the professional factor. I'm Black, yes, Canadian at that point, but navigating businesses in health in Middle East, be it in Saudi Arabia, Qatar, and leading, business in health and investments in really completely changed my career. And that's why I spun from a typical public health research to management consulting in healthcare. That's why I founded CHS Advisory. That's why today I work in modalities of engaging private sector models, innovative financing, entrepreneurship in healthcare, and the pharmaceutical field. So in short, that's where my career went, and that's why I am today. And I'm very happy to share this with you. Thank you.
Thank you so much, Dr. Maraki. I've had the pleasure of actually working with Dr. Maraki, and with her is where my public health journey began, I can say. And honestly, if you saw her interacting with clients, they really do believe that they can't do it without her. So we do have a lot to learn here. And then without further ado, I'll go on to Jeanette, and you can tell us a little bit about how you came into the public health sphere.
Great. Thank you so much. It sounds like there's a theme amongst all of us of a strong mother figure. So
Yes.
I absolutely love that. I am the only daughter. I have 3 brothers, and I had a mother who was is still 91 years old. I quote her often. She is someone who believes that, you can do whatever it is that you set out to do. And I will definitely show my age. I'm now 64. And back in the 70s, my mother started her own business, and that was so unusual at the time. Her parents were both very well educated, and which was also something that was quite different way back when in the early 1900s. So I did have a really strong role model as to, you can do it, girl, you just keep moving forward. I, though, took a very circuitous route in getting to where I am today. And I do just see my pathway as a continuous journey. I haven't arrived anywhere yet. I'm just navigating toward that next place. But it wasn't until I would say I was 30 years old when I finally finished my bachelor's degree, my undergraduate 4-year. Prior to that, I was a community college student I was on the 5-year plan. Community colleges are 2 years, and I just had no idea what it is that I wanted to study, where I wanted to be, and what field I wanted to pursue. So I did everything from early childhood education. I thought I was going to be a marine biologist at one point. I absolutely loved biology, and it was a mentor at the community college that did tell me that she expected much from me. And she was one of these women that was so crisp, like linen wouldn't even wrinkle on her. Everything was just so perfectly put together. And I thought, you really think that I can do great things? Okay. And so sometimes just a little word of encouragement can get us moving forward into even greater responses than perhaps we could have done on our own. But that really led me from there to get a degree in community health. And so, just as our other speakers have already said, back in the day, there wasn't such a thing as public health. We didn't have it. I graduated high school in 78. And so that wasn't a real field at that time. So when I finally found that there was health education at Towson University, I went there to get my undergraduate degree. At that time, you could teach at a community college if you had a 2-year degree, a 4-year degree. And so I went back to my community college and I taught there for 13 years. And it was there on the very first day I met my husband, another professor. We had 2 beautiful children who I would nurse at home, pass off to him at 7:45 a.m. so I could get in the classroom. I would run down the hall to pick up my babe from him when he would come in. He'd go off to his classroom. I'd nurse her, hand her off. So for 10 years, that was our childcare between the 2 of us. It worked for us, but I wanted to look for positions that were full-time, and lo and behold, Howard Community College came about. And it was there that well, actually, at the other community college, I was there adjunct for 10 years. Howard Community College, I was there for 13 years. At that college, I came in as an assistant professor. And you have to do projects in order to get and raise to the full level of professor. At the time, as my colleagues have already stated, there were so few. In fact, Hopkins at Homewood was one of the only undergraduate programs in public health. Public health at that point was mostly at the master's level. And so there was also a paper that came out, and we're talking the early 2000s, that said, we're going to hit a horrible point of having no public health practitioners because those who are in the field are graying out. And so there was a big push at that time to get public health taught at the undergraduate level. So this is where we started having more undergraduate programs popping up across the country. I thought, wait, get them in earlier. How about if we get them in at the point of a AA degree level? And so that's when I came up with the idea of creating the country's first AA transfer degree program in public health. But I really didn't have much background in that. So that's when I started my journey at Hopkins getting an MPH degree. I had already gotten a degree, a master's in education from Hopkins, and then got my MPH. And actually, the very first undergraduate global health class was piloted at Howard Community College by myself and Dr. Jim Tilch. Some of you may know Jim from George Washington University, but before he left there, he was at Hopkins, and he just so happens to be Ellen McKenzie's husband as well. So it came back full circle of the work that I had done at Howard, and then brought my interest to my MPH program. And then that creation of the AA transfer degree program was the MPH capstone project. Brought it back and then taught it at Howard Community College, where it still is today. Just to let you know about networking, when I was in that program, I served as the student liaison for the Career Advisement Center for Hopkins. I kept in touch with Paul Hutchinson, who's now the executive director of Career Services. That was his first year starting. So it was 3 years ago that Paul reached out to me and said, Jeanette, I have an idea. No one in our in our Career Services office has ever been through the MPH program, would you come back and serve as our first alumni career fellow? And because you know what the program is like. So indeed, it's been my honor, but the journey has well been worth it. And I continue to learn from our amazing students. And with that, I'll stop.
Thank you so much, Jeanette. That was so inspirational. At some point, I forgot that I was the moderator. I was so drawn in. The first time I met Jeanette, I was actually having a really crappy day during one of the first terms at Hopkins, and I just logged on to the career services page and spoke with her. And I think she may have been one of the people that kept pushing me throughout the year. So thank you so much for sharing your journey. Before I forget, the Q&A section is open. So if you have any questions for our panelists, you can put them down there and we will go through them during the after the second segment. And if you want to raise your hands during that time and actually share your questions verbally as well, we would be happy to hear from you. So let's go on. And we've heard so much of your personal journeys, but and it's so easy to be inspired by them. But now we want to learn from them in a way where we can all sort of propagate our careers forward. So let's go through a few questions and you can help highlight a few areas. So my first question is, how do you define career alignment? How has that evolved over time? Maybe I would like to hear from all three if you want to jump on, but maybe I'll start with Jeanette for this one.
So career alignment, I say, look at your passion. What is it that really is within you that you would like to pursue? And understanding that that grows over time as well. So what you're starting at on this journey as a young leader is going to evolve, and it may take a different course. I'd always say, as anyone who comes for career services, when you're looking for jobs, make sure that any of the missions and value statements of that company aligns with your own personal ones, so that you are going to feel comfortable in that role and that you'll feel supported in your journey.
I think that's good advice we can all work off of. Rivka Maraki, if you want to jump on.
Jeanette took exactly what I wanted to say. And this is what I tell my mentees all the time, or anytime I do public speaking about this career or personal development. I always say, go with your passion, because if you go with your passion, then you never work a day in your life. And you're never miserable getting up in the morning to go to work because it's like fun all the time. It's fun. So a lot of people make decisions based on what parents say. It's like, oh, Mom, you're going to become a doctor. No, Mom, I'm not going to be a doctor, but I want to be a health. So really standing your ground and being passionate and staying true to that passion is very, very, very important in creating a satisfying life. And I have to say satisfying life because personal life and professional life, they are so closely linked. So if you're miserable in your professional life, you're going to be miserable coming home, bringing all that baggage that you are unhappy. And just think that you're going to be the majority of the day, you're going to be at your job. So you need to have something that you are really passionate about to keep you motivated and to keep you going and to make you feel like you've really contributed towards something with your time there, which won't be really fruitful or productive when you're engaged in something that you are not passionate about. So I would say, go with your passion. I would also emphasize that creating that balance in your life is also very important. So think about how through your career you're able to also balance professional and personal life, because some professions are extremely demanding. Some are demanding for a period of time until you are really well settled. So think about your journey as something that will result in some sense of stability, whether it's extremely demanding at the beginning or not, but the journey is a journey. And what counts is really that journey, not even your destination, because your destination sometimes changes and evolves. So, I mean, I was doing, public health education and then networking and then research and mentoring. So it evolves. So be ready for that ride.
Thank you for that, Maraki.
I can add to that. Of course, I think what the two previous ones said, passion is key. But I found, for example, and my daughter tells me today, like, right, she's 16. She says, I have no idea what my passion is. Like, so what I want to share is, don't be, so anxious if you don't have a clear passion. Many people don't. And careers should be, yes, if you do have that passion, perfect, good for you. Honestly, I think maybe 50% of people would have that known passion. But where does that passion come from is a self-journey of exploration. So really being able to volunteer. When after biochemistry, for example, I volunteered in the lab, I volunteered in hospitals. I hated seeing blood. And I knew I didn't want to become a medical doctor. So that's how I switched to public health, for example. So go out and explore yourself. What is my passion really? Second, global dynamics of where things are. I'm sorry to say, but today, like when I went into Africa, I said, why I don't want to do public health in Ethiopia was because it was all non-sustainable funding, I'm sorry to say. For example, the USAID, where it was a very vertical program, employed so many people, built their careers based on that, and they have nothing today. That's why I went into something that created sustainability for public health systems. So really, be it private sector, investments, and so forth. So passion, explore yourself and understand yourself of passion, what you want. Look at the global dynamics. AI today is driving a lot of so people that go into public health research, I wouldn't even suggest, so you need to find a different framing. And for you to have that environment, the money, the employer or entrepreneurship that will pay you to make the impact you want. So consider a step by step. Thank you.
Thank you
Yeah.
so much.
And mentoring falls into that also, and I do like the exploration. And you're right, some people might not find their passion, and that's where mentoring is really important. There are some people, even in their adult life, do not know what their passion is. They need some guidance, and that's why I got into mentoring. Another reason why I went into mentoring is that my mom was just absolutely fantastic in providing advice and guidance to people, and whatever advice she gave turned into gold. And when I was younger, it's like, oh my gosh, my mom's gonna ask me to sit down, and I know that's going to take an hour of advice, and I'm like, oh, dreading it. Of course, I wouldn't say that way, but it's like I'm really surprised how much the information she shared with me I have actually internalized and apply it. And I've grown in the process. I've grown from phenomenal mentors, not only my mom, but with Dr. Bob Blum, who mentored me, Dr. John Groopman. So make good use of mentors. But when I think about mentoring, I don't only think about guidance and helping identify that passion from people that are more senior than me, but sometimes it's even just having conversation with my peers. And sometimes it's really having conversation with people that are just emerging leaders themselves. So I would say be open to take advice from anybody and everybody. And observe and document and apply and assess. So continuously, because like I said, it's really a journey. You have to evolve yourself. Like Maraki said, it's like, there are new developments that are happening and you have to jump on that new development. And I mean, I am just resisting this AI movement at this point. I mean, I'm like 65. It's like, it's going to take me forever. I can barely operate all the apps on my phone. But, you have to really make effort to be really marketable and flexible and be open to learning all the time so that you will grow with the field.
And I keep hearing the word journey, and I agree absolutely. The one thing that I'd like to also share is that it, to young women especially, is I I think it was Oprah who said it, that women can have it all, they just can't have it all at the same time. And so much of society pushes on women that we have to be everything all at once. You have to be the perfect mother, the perfect spouse, the perfect professional, all of these things that put so much stress on us as women. And sometimes we have to always, I would say, filter through what is going to be best for you and your journey, because there's also a lot of burnout that comes when you're trying to do everything for everyone and you're put in the back seat. So if there's any advice that I would ever give to my younger self and to young professionals today is enjoy the journey and understand that sometimes, even though you're going to deviate from what you have as your set goal, that deviation may bring about the exploration that's putting you into a new area. But you don't have to be everything to everyone all at once. You're allowed to grow and develop as you move along your journey.
Thank you. I took so much from that. I think you basically touched upon all of the questions I wanted to entertain, but just to reiterate, we talked a lot about passion and job opportunities and kind of touched upon balancing those and how we can go into the financial stability that we want. Dr. Maraki kind of expanded on that. So my next question goes to like, what job search tools or platforms, there are so many these days, it's very easy to get lost in the weeds, have been most useful to you, maybe when you're mentoring or in your career services position, Jeanette, or as you're mentoring your mentees, Rivka and Dr. Maraki, what job search tools or platforms have been most useful, and maybe focusing in on what are some of the lesser known job search strategies or career resources that you would recommend?
For me, the best is the personal connection that you have. Make good use of the personal connection. It's much better than any platforms that exist out there. And when I say use your network, I'm talking about your extensive network. It's like your peers, your professors, anybody and everybody around you, and go to a lot of networking events. Have your cards available, ready to give out. Have your pitch ready. You know who you are. What are you interested in? So you do not stagger when someone asks you, what are you interested in? So go confidently and be prepared what your pitch is, and show your passion. If someone shares with me something that's really dull, I'm interested in research, and it's just, it's like I feel like, are you motivated? You need to really learn how to really promote yourself. And so, Maraki and I can attest to this, because we're Ethiopians. We're told to be very humble and not share much about ourselves. And that gets in a way in terms of how we develop professionally, internationally, because you have to speak about yourself. You have to speak about your work, and you have to lead with that as you seek jobs. So sometimes that cultural, conflict arises, but when in Rome, do like the Romans. So I would say just learn how to, to promote yourself effectively, and use your network. Still, in spite of all these technologies that are out there, the best way to find a job is through your networks. But of course, you can use other technologies, and I'll let the others speak about that and more. Thank you.
I exactly. I'm with Rivka, absolutely. And I think I try and think what I've done so to get to where, but systematically, for example, if that helps. So once you know your passion or what you want to do, be prepared. Yes, be prepared. How do you showcase yourself when you go to the networking? I'm I hate networking sessions, to tell you the truth. I'm like even after all this coaching, I'm I'm nervous throughout. So usually I avoid those and I only go to people that I'm comfortable with, like, look, even, so really talk about yourself, but be prepared of what you want. I do use LinkedIn quite a bit now, more recently, to see for projects. For me, it's really about business development and identifying the right events to be at and showcase myself. The other one where I see people I would employ are people that Ruka said, like fikr, or people who would come to my door and boldly tell me something and I'm interested in them, and I would say, hey, tell me more about yourself, and then let me employ you. So it's really about knowing yourself and what you want. But I always remember throughout my path, my career pathway, when I was younger, I remember going around, for example, in Toronto and trying, when I got employed with Canadian Institute for Health Information, it was an effort. It was a big corporate. People were not being employed. It was very difficult to enter. I would investigate who works there. I would walk past the office, write exactly, who works there and what are they doing? How do I pitch myself to them? So it's not just sending my CV. I did my work, my research throughout, and that helps, so if it helps.
I agree with everything. And I just threw in the chat a few things if anyone wants to just pull them off onto their desktop. The first is staying connected with our career services office. And please know, as I always say to everyone, it's not a one and done. You can meet with career service advisors as oftentimes as you need, and even post-graduation. So once you're out there, and in fact, we're doing a real big push right now for all of our graduates who are working in places like WHO and CDC and USAID, who are finding themselves without a job right now. So we are working actively for our students and our alum. So please, I just love meeting with our students and alum and getting the feedback as to what they're doing now. I also understand about the AI, and I just went through a program on pivoting and rebranding, if anyone else had been in that a couple of weeks ago, and they shared with the group these AI prompts. And I thought that they were amazing, and I tried them and I'm hooked. I'm going to tell you, if you just try putting it in to Google Chat GPT, then it's amazing. Understand their tools and that you can't just use them blindly. You have to make sure that you are going through and putting your own personal touch on it. Job interviewing as well as networking is always scary. I just put in there a job interview cheat sheet as well, because I know many of you right now are getting ready to interview for positions. And so we can help you also in career advising, from everything from interview skills to networking. In terms of networking, absolutely, the networking events. Marie Diener West does such a terrific job of pulling together networking alumni events. She just recently hosted one in DC. There was another in Baltimore. Please make sure that wherever you are on the globe, you're looking to perhaps find a group of, I always call us family, because we are. Once you become a Hopkins family, you are for life. And so we are the #1 school of public health. We're the #1 most recognized school of public health globally. So we are all over the place. I can teach you, if you don't already know, how to use LinkedIn to get to our alum. And so that's a great tool to use. So feel free, if you don't see in Handshake a appointment, just send me an email. And in fact, I'll put my email in the chat, and then we can set up an email Handshake. I know Tecker and I have met a few times, and it's just been delightful. The other thing is OneHop. Make sure that you're looking at that, because I've heard mentorship mentioned a few times. On OneHop, ONEHOP, on OneHop, you can find mentors that are in your field who are all Hopkins family.
Thank you so
That's
much.
great. I didn't even know that.
Yeah.
Thank you.
Yeah, there are so many resources in Hopkins. I think maybe the problem is the width and breadth of the resources, and you kind of get lost. So Jeanette has been
AI for that. AI
streamlined.
to sort, streamline.
Exactly. I'm glad AI kind of crept up into the conversation because we can't avoid it. So we might as well learn to use it in a helpful and appropriate way. So
Yeah, I can't imagine really seeking a job in this market without really having some, level of sophisticated AI experience.
Mm.
So most definitely go ahead and take as many courses as possible regarding, technology and AI. Yeah.
absolutely. Absolutely. The time is kind of getting away from us. That's been so interesting, and I think we all took away a lot. I have not seen many questions in the Q&A, so maybe I'll go ahead with my next question, but please do drop any questions you have for our panelists in the Q&A. And Megan has shared a link where you can be part of the Edge Society as well. I will also bring up the QR code at the end. But yeah, as we're wrapping up, maybe I'll merge two of my last questions into one just because they touch a lot upon each other. So early career professionals at the end of the day are kind of veering into leadership roles before they're ready to be in those leadership roles. So how can early career professionals build leadership skills before they're kind of surprised with those leadership roles? And what common mistakes do you see early career professionals make when they're doing their job search earlier on in their career, and how can they avoid them? Anyone who wants to touch
It's
on
a tough one. I know I'm waiting for Rivka to come in, but
I will give you,
Go
it
ahead.
really automatically, what I was thinking about this, it was when I was in Boston, and we hired this student, my boss and I hired the student that was just graduated with her master's in public health. It was either from Hopkins or Harvard. And we had to fire her soon after we hired her because she was a know-it-all, and and she did not know it all, and she was just like really know it all. And if she presented herself that way in our meetings and interaction with my boss, we can imagine how she was going to be with outsiders. So really being humble. I talked about earlier about being humble and humility, but really being humble and be clear about what you know, what you don't know. You need to show eagerness that you're willing to learn. If you're presenting yourself like, oh, I know it all, I'm not, it's everything. It's just take guidance from people, be eager to learn, be humble, and present yourself in a way that you're open to learning. If you're presenting yourself in a way that you already know it, then why are you here? Why did you apply for this position? Why didn't you apply to be the director of something? So just keep that in mind is what I would say. And then sometimes those positions that may not pay well, maybe the positions that will lead to greater things. So just really do not be quick to dismiss opportunities that are presented, because again, going back to that journey, what matters is that journey. So if you're in the right journey, then things will continue to grow. So I would say use your vision board to also guide you. So visualize it. If you visualize it, then you'll actualize it, right? So think about, so if you think as a journey, rather than destination, then you would be less frustrated with the process. And I would say also, this is a very competitive period. So be gentle with yourself and have a little bit of gratitude for yourself, and also self-care. And the last thing I would say is that, if 500, I'm hearing from people that are like, oh, I posted this position and we have 500 applicants. I really heard this. It's like, you know what? When you're out seeking jobs, be confident. Yeah, there may be hundreds or thousands of people, vying for that position, but be confident and always compete with yourself. Not compete with others, but compete with yourself and present your best self forward, because that's the best way that you can present a confident you.
So I know in the interest of time, I agree. So leadership is not necessarily for everybody. And I find leadership, you need to be clear. Is it about more money or is it about more responsibilities within the sector you're in? So it does take learning. I find when I finally founded my company, Shafiqah knows, I was like, I just don't want to manage people anymore. Maybe this is not for me. So, so leadership within, it becomes management of people. You need to be good with people. You need to be willing to hear criticism constantly as well as feedback. Be really, so is it for me? Is it about money? Then decipher the two, right? Is it about career path towards leadership for more money, or is it something you want to do? Trust me. So that's why my advisory would never be a big boutique where I'm still managing hundreds of people. Never. My leadership style came to be more about sharing more of a social impact and listening, even to the youngest interns that come to my organization. Thank you.
So the last thing that I would say is don't be afraid to step off the path of that straight and narrow journey and keep yourself open to learn. A lot of times we come to that area of passion or where we want to be because of all of the things that we've already figured out that we don't want to do. So that's one of the things that I often ask my students, what is it that you found that you don't like? Like we heard, I don't like the sight of blood. So now that's great. Now you know those clinical type positions aren't going to be the ones that you pursue. You don't have to know where you're going to end up. Start the journey, be curious. And I love the adage, if you can't serve as a good example, you'll have to settle for being a horrible warning. And every interaction that I have with leaders in the field, I look to them. Is that a person that I would like to emulate? Or is that someone who I see and feel in my soul, I don't want to be like them? And so I use them as that example. But the journey is where the true richness is. Don't be afraid of the journey. Reach out to those who have been further down the path and allow them to help guide you. But also, they know that if they're true leaders, that they will also learn from you. So
Thank you so much, all of you. It's been such a wonderful conversation, and I'm sure we will keep learning and growing more and more as the EDGE webinar series continues on. This is one of many, so please be on the lookout as we open up more and more webinars in the upcoming weeks. Thank you so much to our panelists. I myself have learned a lot, and I've known Meraki for many years. I've known Jeanette and Durga for much less, but I've been listening to you all like I didn't know any part of your journeys, because it's interesting and I learn something new each and every time. So thank you so much for making the time and for being here. I just want to quickly pop this up. If you want to keep following on EDGE's journey to become a member of the larger EDGE Society, to become a member of the Student Society, to connect with us on Instagram, on LinkedIn. If you want to be connected to any of these women, we will see if they have the opening to speak with you. You can email us on the emails at the bottom. There is only one question in the Q&A so far. I'll just leave this up until you can all answer that question. If anybody wants to jump on that, please feel free. The question is, how do you juggle motherhood, family, and careers in this day and age? I think we've touched up on it a little bit, but before we close out, maybe you each can take about 30 seconds, 1 minute, and answer that question.
Sometimes it's all about not having to do everything, not setting goals that are too much. Sometimes I leave everything and I'm sitting with my family, and if I'm too tired and so forth. So don't feel pressured. Do what you can.
I would also add, select your partner very carefully so that you would have a supportive partner that can help you juggle your personal and professional life, so that it would just not be up to you to juggle the motherhood and home responsibilities as well. So pick your partner carefully.
I couldn't agree more. Tomorrow, my baby will turn 31. Everybody told me it goes by in a blink of an eye, and it
Yeah.
does. Enjoy your
Yes.
babies while they're babies and allow yourself to really embrace motherhood, if that is something that you want, because it's very fleeting in the time that we get to hold those precious gifts in our lives.
That was some great advice, and I hope the person that put the question down has gained a little bit of an insight, but I'm sure it's a bit of a journey, so you can't strategize it all. Thank you so much for the for Edge Network for helping us organize this and host this. I hope all of the participants have gained at least one takeaway from this. I know I have. Thank you to our panelists, Rivka, Dr. Maraki, and Jeanette for very openly sharing your journeys. And just so you know, these three women, I've spoken with them on various occasions. They have this kind of energy all the time. So they really do love what they do. And I'm in awe of them anytime I meet them. So thank you so much for making the time. Megan, if there's anything else that you want to add, otherwise I will close this out.
Yeah, thank you so much for your skillful moderation. I'm really impressed, and just to the whole Edge Student Society team for partnering with Edge. Really, really excited for this. Panelists, cannot thank you enough. This has been so inspiring. Just all of the thanks are coming up in the chat. I hope you can read them. Everybody's very inspired. So yeah, we will share this recording once we process it, and hopefully we'll also have the next date for our May session as well. So I hope everybody has a wonderful week. Stay strong in this crazy climate that we're in. And yeah, hope everyone will be well. Thank you so much.
Thank you.
Thank you.
Thank you.
Wonderful day all. Bye.
Bye.